Good morning, Andrew Paulson. I am Mihiraa. Let's start the warm-up sessions. Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivating and am equally comfortable working alone.
Would you say you're a team player?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I enjoy working in a team because I often find that different viewpoints can help me find solutions to a problem I might not think of on my own. I also enjoy self-motivation and am equally comfortable working alone.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Tell me what you feel is your greatest skill as a nurse.
My greatest skill as a nurse is my communication ability. I'm very proud of my ability to listen to what a patient is telling me. Nothing frustrates them more than feeling as though they're not being heard, and actively listening can help make someone comfortable. In addition, I learned that addressing their concerns and communicating assuredly make them feel comfortable, which is important to receiving quality care.
What do you find rewarding about being a nurse?
I truly love helping people, and the most rewarding thing for me as a nurse is seeing the joy of patients and their families. It is always a priceless feeling to see our patients recover to a normal life after going through a difficult time. Throughout my years as a nurse, I have seen many heartbreaking times as well, and being able to help those families cope with loss has been very difficult, but also rewarding.
Your preparation time is over. You can now start the role play.
Hello, I'm Nurse Andrew Paulson. I understand you brought your daughter to the emergency department. I want you to know that we are here to help and that it's a good thing you came in to have her checked. To start, could you please tell me what happened that led to her visit here today?
Thank you, Nurse Andrew. She was playing on the monkey bars at the park, and she just lost her grip and fell. Her head hit the ground pretty hard. She started crying right away, but she seems a little better now.
I see. Thank you for telling me. It's really helpful to get all the details. May I know your daughter's name, please?
Sure, her name is Ashley.
Thank you. How may I address you?
You can call me Mihiraa.
Can you tell me more about the fall itself and any physical effects on the child, such as nausea, vomiting, dizziness, or headache since the fall?
She was on the last bar, so not very high up. She landed on the grass, but her head still made a loud thud. No, she didn't lose consciousness. She started crying immediately. She hasn't thrown up or complained of a headache or dizziness. She just seems a bit tired and clingy.
Thank you for providing that information, Mihiraa. The next steps will involve a physical examination, where I'll be checking her over carefully to make sure there are no other injuries. I will also be checking her vital signs, such as her heart rate and breathing, to make sure everything is stable. After that, a doctor will come to assess her and decide on the appropriate treatment plan. Do you have any questions or concerns about that process?
That sounds fine. But how long did she have to wait? I am very worried. She's my only child.
I know how difficult it is to wait, especially when you're worried about your only child. I want to reassure you that we understand your concern, and we'll do everything we can to get to you as soon as possible. The waiting time in the emergency department can be unpredictable because it's dependent on the priority of the cases that come in. We always have to attend to the most critical patients first, such as those with life-threatening conditions or serious accidents. I want you to know that your daughter, based on her apparent condition, is doing very well. She appears alert and responsive, and from what we can see so far, there are no obvious signs of a serious injury. We'll continue to keep an eye on her while you wait. We understand her anxiety, but please be assured that we are taking her needs seriously and will attend to her as soon as we can.
That's a relief to hear. But what about her first aid treatment?
That's a very good question, Mihiraa, and it's completely understandable that you're thinking about that. Thank you for bringing her in so quickly. I'd like to talk you through some first aid measures. The first step is to gently clean the wound with some clean water to remove any dirt or germs. If it's bleeding, applying gentle, firm pressure with a clean cloth will help stop it. To help with the swelling and discomfort, you can also use a cold compress on the area. Have you already done any of these things for her since the fall?
That's a relief to hear. But what about her first aid treatment?
Mihiraa, it's completely understandable that you felt you needed to come to the hospital right away. That was the best thing you could have done. It's also normal to feel a bit anxious about handling things at home, but I can assure you that with a little guidance, you'll be able to manage her care and recovery just fine. The most important thing to focus on at home is monitoring her closely. Please watch for any changes in her behavior. If she seems unusually irritable, confused, or more tired than usual, that could be a sign we need to check her again. You should also watch for any physical symptoms like increased drowsiness, repeated vomiting, or a severe headache that doesn't go away. These are all reasons to bring her back here. Additionally, if she develops a fever or you feel that her overall condition is getting worse, please do not hesitate to return to the hospital. Your instincts as a parent are very important, and we're always here if you have any doubts.
Okay, thank you, Nurse Andrew. That makes me feel much better. I'll definitely keep a close eye on her, and I won't hesitate to come back if I see any of those things you mentioned. I really appreciate you taking the time to explain everything so clearly.
That's wonderful to hear. I'm glad I could help ease your mind. It's so important that you feel confident and comfortable with the plan. Now that we have a clear understanding of what happened and what to look for at home, Mihiraa, I need to officially get your consent to begin the physical examination and take Ashley's vital signs. This is a standard procedure to ensure we've covered all the necessary checks. By agreeing, you're giving us permission to proceed with her care. Is that okay with you?
Sure, you may please.
Mihiraa, we've gone through everything. I'll quickly summarize our conversation to make sure we're on the same page. You brought your daughter Ashley to the emergency department after she fell from the monkey bars and hit her head. Although she seems alert and responsive, and we don't see any obvious signs of a serious injury, we've gone over the next steps for her care. We'll start with a physical examination and take her vital signs, and then a doctor will assess her. We also discussed some basic first aid you can use, such as cleaning the wound and using a cold compress, and I've assured you that it's okay that you came directly here first. Finally, we've talked about what to look out for at home, including signs like increased drowsiness, vomiting, or a fever, which would be reasons to bring her back. You've given your consent for us to go ahead with the examination.